Rising levels of bureaucracy and cuts to service users' budgets are leading to plummeting support for personalisation, exclusive research carried out by Community Care is showing. The annual study, which is carried out on behalf of Unison, shows that support for personalisation has fallen annually since 2009. Then 67% thought personal budgets would benefit service users. Now just 41% do. The cuts are a prime cause of the discontent. 83% of social workers now think that budget reductions to adult care will impede the progress of personalisation. The study also showed that 73% of social workers said personalisation had resulted in more bureaucracy for them, up on last year's 66%. Comments from social workers reveal the level of frustration felt by many, which is often due to overcomplicated resource allocation systems.
The personalisation paperwork takes 3 times longer to complete. A very difficult job has now become impossible. We cannot do our jobs and keep people safe with ridiculous bureaucratic tasks to complete.
The authority is using personalisation as an excuse to reduce the costs and the quality of packages of care. Service users are incensed, and particularly their carers are incensed that they are having more and more responsibility placed on them and have a general mistrust about the reasoning for personalisation and a misunderstanding of how services will be delivered in the future.
The study also finds slow progress on personalisation in many local authorities. 38% said their council had made only limited progress in transforming services, despite the 3-year social care reform grant money to personalised services in English councils. Social care leaders have already acknowledged they need to do far more in persuading councils to reduce the administrative demands on social workers, and there is likely to be far more in this said throughout the year. But there is nothing they can do about the cuts. This creates the danger that personalisation is seen increasingly as a vehicle for cuts and control, rather than as one to improve outcomes for service users.